Good morning, sir. My name is Regina Colleen and I will be your nurse for today. This assessment, I will be assessing your musculoskeletal system. So, before we start the assessment, make sure that we perform hand hygiene to avoid spread of infection or diseases. Then, make sure that we give clients privacy by closing all the curtains. So, before we start the assessment, I want to ask you some questions about your health history. Do you feel any pain from the past or today? Do you feel any pain from your muscles?
Nothing.
Okay. Do you have any injuries from the past galing sa sports? Ka-injury ka na ba galing sa sports? Okay. Meron ka bang iniiwasan na movement kapag may ginagawa kang activity?
The ankle.
Ano?
Ankle?
Ano may iniiwasan mo sa ankle?
Yung sprain.
Okay. So, now, we start the assessment. So, first thing we need to do is to inspect the muscle for size. Compare each muscle on one side of the body to same muscle on the other side. So, inspect. So the patient have equal body size and the both sides are equal. Then second is inspect the muscle and tendons for contractures. So now I don't see any signs of contractures. So now we move on to inspection of the muscle for tremors. So I don't see also any signs of tremors. So now we move on, or we proceed to palpation and test the muscle strength. So the test muscle strength is composed of sternocleidomastoid, the trapezius, deltoid, biceps, triceps, the fingers and wrist muscle, the grip strength, the hip muscle, the hip abduction, the hamstrings, quadriceps, and the feet and ankle strength. So now we start the test muscle strength. The first is sternocleidomastoid. So, the sternocleidomastoid, i-ano mo lang, lalabanan mo lang yung kamay ko. The other side. And dito, i-aangat mo naman yung ano. Angat mo. Sige. Then, the deltoid, i-ano mo, preparsahin mo. Labanan mo yung kamay ko. I-angat mo. Then, the biceps and the triceps. Then, next is the fingers and the wrist muscle strength. So, ganun ka. Ay, ganyan ka. Ganyan pa. Lalabanan mo yung ano ko, kamay ko. Both hands. Yeah. Then, the next is the grip muscle. Ganyan. So, this time, the hip, I will continuously test the muscle strength of the hip muscle, hip abduction, the hamstring, the quadriceps, and the ankle and the feet. Higa po kayo. Higa ka na. Then, move your feet here. Hanggang saan yung kaya mo. Then, balik mo. Then, here. Then, next is the other side. labanan mo yung kamay ko. Dito sa kabila. Dito. Then, the feet and the ankle. Okay. So, while we doing the strength test muscle, do you feel any pain from your muscle? No. So, his muscle is strong and I don't see any abnormalities or fracture or what. Hindi po kayong tumayo, sir. After the test muscle strength, we move on to inspection of the skeleton for normal structure or deformities. Pwede po pahubad po ng ano. Sa harap. So, sa aking inspection is I don't see any deformities and he has a normal structure of skeleton. Then, we proceed to palpate the bones to locate any areas of edema or tenderness. So, this time, we need to palpate the bones for any signs of edema or tenderness. So, there's no sign of edema or tenderness. So, after that, we move on to inspection of the joint for swelling. Move nyo po yun. And I don't see any signs of swelling and the client's joints are normal and moves smoothly. Then next is assess joint range of motion. So lastly, document all the findings in the client's record. Thank you!